Okay, everybody, Dr. Rafich here from Vet Triage. Let's just fix this. We are going through a brand new edition of JAVMA. Here we go. There we go. All right. June 1st, 2015. And we are going to be talking about what's your diagnosis. There it is. There it is. What you're seeing there is a CT scan that we'll go over here in a minute. So this is a transverse CT scan of a 6-year-old male neutered Cocker Spaniel evaluated because of pruritic erythematous skin and gynecomastia of 2 months duration. They palpated abdominal mass and they performed the CT scan with contrast medium. And so this is the first image there. So the spinal cord is up top. That's the vertebral body, and then on this side you see this white dots. That's vascular supply to an abdominal mass, which is right there. And then on this side, that's the kidney that's being highlighted. And so those structures that are white, the kidney there, the blood supply to the mass there, as well as the aorta underneath the vertebral column. That's because there's contrast material. The vertebral body is white because it's bone, so it's going to show up as white. The dog was neutered at 10 months of age and reportedly cryptorchid with a physically normal left testicle and an intra-abdominal right testicle, supposedly removed by laparotomy. The study comes out of the Royal Veterinary College in London. So they performed a CT scan. On this image here, you'll notice the left kidney. So this is the same image as before, but now with labels. This is the aorta, this is the vena cava, this is the pampiniform plexus, which is the blood supply to the testes. This is the mass, which turns out to be a testicle in the abdomen, and then this is the spleen. In this image here, they're showing you another view where you can see the blood supply of the mass going to the aorta. This is a somewhat sagittal view. Here's the mass, urinary bladder, and prostate. Diagnostic interpretation: a globoid, well-marginated, soft tissue attenuating mass measuring approximately 7 by 5 centimeters is evident in the mid-abdomen to the right of midline at the level of the caudal pole of the left kidney and the tail of the spleen. A discrete collection of small tortuous vessels visible on the dorsal aspect of the mass and is characteristic of the pampiniform plexus of the testicle. The marked enlargement of the testicle and globoid shape are compatible with neoplastic transformation. Treatment and outcome: serum estradiol concentration was high at 30 pgs per ml. I think it's picogram, indicative of a Sertoli cell tumor when it's over 15 pgs per ml. They removed it surgically and the symptoms resolved. Comments: right-sided inguinal cryptorchidism is the most common form, followed by right-sided abdominal cryptorchidism. Neoplasms occurring in the mal-descended testes may behave more aggressively than tumors occurring in the scrotal testicles. Testicular tumors that produce estrogen or estradiol cause a feminizing paraneoplastic syndrome characterized by non-pruritic bilaterally symmetric alopecia, hyperpigmentation, gynecomastia, edematous and pendulous penile sheath, prostatic dysfunction, attraction to other male dogs, and standing in a female position to urinate. Sertoli cell tumors are most commonly associated with feminization syndrome in male dogs. Distant metastasis of Sertoli cell tumors occurs in less than 15% of dogs. Persistent or recurrence of clinical signs of feminization would suggest another source of hormone production as a result of metastasis. Abdominally retained testes usually occur in the caudal-ventral aspect of the abdomen and are small and oval, with a central mediastinum that is visible on ultrasound. Enlargement, a change in shape from oval to globoid, a loss of mediastinum, and a heterogeneous echo texture are signs of neoplasia. Additionally, swelling of the spermatic cord suggests testicular torsion. So pretty cool case. We do see these; they're not that common, and clearly their history shows maybe unethical behavior on whoever claimed that the cryptorchid testicle was removed, or they removed some other part of the body intra-abdominally. In any case, you have to always be thorough with the history taking and ask about these types of things, because sometimes these dogs get neutered or spayed in sketchy areas. You want to get the surgery report to see what their report says. If they don't have a surgery report, that's also sketchy. You want to talk to the doctor who performed the surgery and see whether or not they did what they say they did. And you have to be wary of anybody who claims that they were told that their dog was born with only one testicle, because that is insanely rare. It is more likely to have a retained testicle in the abdomen or inguinal canal than it is to be born with just one testy. So typically there's one descended and one cryptorchid. Don't believe anybody that says my dog was born with just one. It's possible, but insanely rare, and so very, very unlikely. Yeah, and so that's a good learning case, pretty straightforward. We'll see you guys in the next video. Take care.